Welcome to our channel. In this video we will see, when is a Caesarean section scheduled? Before we begin, please like this video, give it a thumbs up, and share it with your friends. A cesarean section is usually planned around the 39th week of amenorrhea, or 8.5 months of pregnancy. In the event of a scheduled cesarean, you are hospitalized the day before the operation. In the evening, the anesthesiologist makes a final point with you and briefly explains the procedure for the operation. You dine lightly. The next day, no breakfast, you go to the operating room yourself. A urinary catheter is put in place by the nurse. Then the anesthetist installs you and sets up spinal anesthesia, after having already locally numbed the area of the sting. You are then lying on the operating table. Several reasons may explain the choice to schedule a cesarean: multiple pregnancies, the position of the baby, premature birth. Scheduled cesarean, for multiple pregnancies. When there are not 2 but 3 babies or even more, the choice of cesarean section is most often necessary and allows the entire obstetric team to be present to welcome the newborns. It can be done for all babies or just one of them. On the other hand, when it comes to twins, vaginal birth is quite possible. In general, it is the position of the first, verified by ultrasound, that decides the mode of delivery. Multiple pregnancies are considered high-risk pregnancies. It is for this reason that they are subject to reinforced medical monitoring. To detect a possible anomaly and take care of it as quickly as possible, expectant mothers have more ultrasounds. Pregnant women are often advised to stop working around the 6th month to reduce the risk of premature birth. A scheduled cesarean section due to illness during pregnancy. The reasons for deciding to perform a Caesarean section may be a maternal illness. This is the case when the expectant mother suffers from diabetes and the probable weight of the unborn baby is estimated at more than 4,250 grams, or 4,500 grams. This also occurs if the mother-to-be has serious heart problems and expulsion efforts are prohibited. Likewise, when the first outbreak of genital herpes occurs the month before childbirth because a vaginal birth could contaminate the child. Other times, there is a risk of bleeding, such as when the placenta is inserted too low and covers the cervix placenta previa. The gynecologist will perform a cesarean without delay even if the birth must be premature. This may especially be the case if the expectant mother suffers from preeclampsia, high blood pressure with the presence of protein in the urine, which resists treatment and worsens, or if an infection develops after a premature rupture before 34 weeks of amenorrhea of the water bag. Last case, if the mother is infected with certain viruses, in particular HIV, it is preferable to give birth by cesarean section, in order to prevent contamination of the child when passing through the vaginal tract. A cesarean is also planned if the mother's pelvis is too small or has a malformation. In order to measure the pelvis, we do an X-ray, called pelvimetry. It is carried out at the end of pregnancy, in particular when the baby presents by the breech, if the future mother is small, or if she has already given birth by cesarean section. The elective cesarean section is recommended when the baby's weight is greater than or equal to 5 kg. But since this weight is difficult to assess, it is considered that the cesarean section is to be decided, on a case-by-case basis, if the baby weighs between 4.5 grams and 5 kg. The impact of old Caesareans. If the mother has already had 2 Caesarean sections, the medical team immediately suggests performing a 3rd cesarean section. Her uterus is weakened and the risk of rupture of the scar, even if it is rare, exists in the event of a natural delivery. The case of a single previous Caesarean section will be discussed with the mother depending on the cause of the intervention and the current obstetric conditions. Note that we call iterative cesarean section a cesarean section undertaken after the first delivery by cesarean section. The baby's position may lead to a scheduled cesarean. Sometimes it is the position of the fetus that requires the cesarean section. If 95% of babies are born upside down, others choose unusual positions that do not always make it easy for doctors. For example, if he is crosswise or his head instead of being flexed on the thorax is completely deflected. Likewise, it is difficult to escape a cesarean section if the baby has settled horizontally in the uterus. The case of the seat 3 to 5% of all births decides it in each case. In general, we can first try to tip the baby by practicing an external version (VME). But this technique does not always work. However, a scheduled cesarean is not systematic. The High Authority for Health has recently re-specified the indications for a scheduled cesarean section, when the baby presents by breach, unfavorable confrontation between pelvimetry and the estimation of the measurements of the fetus or persistent deflection of the head. She also recalled that it is necessary to monitor the persistence of the presentation by ultrasound, just before entering the operating room to perform the cesarean section. However, some obstetricians still prefer to avoid the slightest risk and opt for a cesarean section. A cesarean section of convenience. A cesarean section on demand corresponds to a cesarean section desired by the pregnant woman in the absence of medical or obstetric indications. Cesarean section is a frequent gesture in obstetrics, well codified and safe, but remains a surgical intervention associated with an increased risk to the health of the mother compared to childbirth by natural means. In particular, there is a risk of phlebitis, formation of a clot in a blood vessel. A cesarean section can also be the cause of complications in future pregnancies, poor positioning of the placenta. Thank you for watching. For more information, please click the first link in the description. If you like this video, give it a thumbs up and share it with your friends.